Good morning, everyone. I am Althea Castillo Sangalang from BSNY1M4B, and today I'll be doing the demonstration of post-mortem care. Hello, student nurses. For today's video, I will be demonstrating to you how to perform a proper post-mortem care. Before we begin, what is post-mortem care? Basically, it refers to the physical care of the patient's body who has recently expired. This can be performed in a home care facility or hospital. It has to be done in order to prepare the body for viewing by the family. To prevent discoloration or deformity of the patient's body, make sure that you are also aware to the cultural, religious, and age-related considerations when delivering this care. Now let's get started. The first thing you want to do is to check the chart for the physician certifications of the death of the patient. Upon doing so, always take note that postmortem care must not be performed until the patient has been pronounced dead by the doctor. So always verify first before performing the procedure. Second is to prepare the necessary materials. This is to save time and allows you to work efficiently by eliminating the need to go to the supply room for items have overlooked. Next is to ask for permission and explain to the significant other that you are going to perform the postmortem care. This is to reduce the significant others or the family members' anxiety, and of course to enhance their cooperation. Then ask the family member if they want to remain inside the room during the procedure. This is to ensure that they may be aware of how the procedure is done or if they want to assist to the care of the body. Next step is to close the door to provide privacy. This is to protect patient's integrity and to show respect to the family and the deceased. Next, pour lukewarm water into the basin. This is to prepare the bed bath of the deceased. Wash his hand and put on clean gloves. Even though the patient is already dead, the nurse needs to follow universal precautions. Next, remove jewelry or any personal items of the patient and give them to the significant others. This is for legal purposes to ensure that the nurse will not be charged of stealing. Closes the patient's eyes, put on dentures if any, and then closes the patient's mouth. Closing the eyes of the deceased is a form of showing respect and eternal rest. Removes all equipments, tubes, supplies, and dirty linens, according to the hospital protocol. The nurse needs to remove everything to prepare the patients for the funeral. Next, remove patient clothes carefully as to not expose any body part. Even the patient is dead, the nurse needs to provide respect and privacy. Perform bed bath on the patient in order to prevent any discoloration. Put cotton balls on patient closed eyes, in the ears, and in the outer ear. Then secure each with a tape lengthwise so that the secretion in the eye, nose, and ears will be drained in the cotton. Secure the patient's jaw with a cravat. This is done because after 15 to 20 minutes, the patient's jaw will open and stiffen. Put on the diaper, underwear, and patient clothes in order to drain secretion in the diaper and put on clothes for decency and respect. Give the family option to view or not to view the patient and accompany them as they do so. Compassionate care provides family members with a meaningful experience during the early phase of grief. Encourage the family to say goodbye, just as to give them time to say goodbye to their loved ones and allow some time to the grieving process, as if they would like to live alone, just as to provide privacy. Applies name tag on the hand and foot. Labeling ensures proper identification of the body. Covers and secure secure the patient with a shroud. Secure the shroud with safety pins. The shroud protects against injury to the skin, avoids exposure of the body, provides a barrier against potentially contaminated body fluids. Secure another name tag on the shroud. This is to ensure proper identification of the patient prior to transportation to the morgue. Transport patient to the morgue for embalming or autopsy. Documents the procedure and wash hands. Data from the documentation provides information about the patient characteristic and care outcomes. Good morning everyone, I am Althea Castillo Sangalang and today I'll be doing the return demonstration for hot and cold compress. I'll start by performing hand hygiene, also known as hand washing. Then, greet and identify the patient. We do this procedure so that we won't give care to the wrong patient. In doing this, we can ask for their full name and birth date. After that, we can now proceed to providing privacy. In providing privacy, we can just close the door or curtains and prepare the materials. After that, we can do hand hygiene and gloving. And we can now proceed to providing hot and cold compress to a patient. Make sure that when providing hot and cold compress, you will check for the monitoring or reaction of the skin of the patient. A hot compress is a method of applying heat to the body to help relieve pain and muscle stiffness, improve blood flow, and promote relaxation. It can be used for various conditions like muscle ache, joint pain, eye infection, and even menstrual cramps, while the cold compress is used in acute injuries with swelling, inflammation, and pain, particularly within the first to 48 72 hours after an injury. They work by constricting blood vessels, reducing blood flow to the area, which helps to minimize swelling, inflammation, and pain. After positioning the client in the comfortable position, I will now perform hand washing, also known as the hand hygiene, to prevent the contamination or the cross-contamination of microorganisms between the patient and the client. After hand washing, make sure to document the findings.